Volunteering can take the form of engaging in advocacy. An advocate is someone who pleads the cause of another, defends or maintains a cause or proposal, or supports or promotes the interest of another. Advocacy typically intends to influence public policy. However, it can take many forms.
I mean, educating the public, I just consider to be my job. I've never really thought of it as philanthropic, but that's an interesting perspective.
I'm looking to actually testify again here this summer in Sacramento for a bill that would raise the age of care in the state of California from 18 to 21.
We do get involved, and I personally will testify in things at the state level and even the federal level to talk about the realities of those issues, because we're dealing with people in their messy lives and all those circumstances.
And you can always raise the question about the motivation of government doing something, or political people like me that change public policy may have the best of altruistic intentions, but it's questioned.
In other countries, healthcare is considered a right. Here, it's not. And all you need to do is talk to our patients who are not welcome, not able to receive healthcare in any number of environments.
Well, our mission simply is to abolish the death penalty. We have one of the simplest missions of any nonprofit, I think, anywhere. But we understand that this is an incremental process where we have to talk not only about our ultimate goal of ending the death penalty, but what are the alternatives?
I just felt like, having had the opportunity to go in to meet with governors and plead for the life of somebody, having had the opportunity to bring somebody else, the mother in one case of a man who was about to be executed, in to meet a governor who wouldn't have met with her if it hadn't been for my presence.
Political organizing is another tool that we use. It's not so much in terms of lobbying, but in terms of working to put facts and figures and statistics and arguments in front of our political leaders so that they have the tools necessary to make the right decisions. In effective social service programs, in child abuse prevention programs, in mental health programs, in poverty reduction programs, in education programs, all those kinds of things. That's what leads to a safer society, a less violent society. In fact, the police chiefs of this nation have been polled time and time again, and less than 1% think that the death penalty of the police chiefs of this nation believe the death penalty is a crime-fighting tool, is a way to somehow reduce violence in our communities. Our work is about trying to change hearts and minds in terms of what kind of society we want for ourselves. What lessons do we want to teach our children?
We depend on these volunteers and community groups to help spread the word. And so our hope is that, there'll be more awareness for this disease, and that our hope is that there'll be more good news from, the pharmaceutical companies and from the FDA.
It affects my life in many, many ways. Not only what I used to be able to do versus what I can do now. It affects me financially, socially. I know there are many people who try to keep it hidden because they don't want to be treated differently. But for me, I like to tell people about it. I want people to be aware of lupus